Today, I'm joined by someone who has seen healthcare transformation from literally just about every angle, Edward Marx. Ed is a former global CIO, current CEO of Marx Advisory, best-selling author and advisor who has spent years helping healthcare organizations rethink leadership, innovation, and digital transformation. He also recently co-authored the AI Empowered Patient with his wife Simran Marx, exploring how AI is reshaping the future of care. So I'm really excited for this conversation just because Ed has operated across so many sides of the system, leading change from within and now helping shape it from the outside. That perspective is really rare and it shows up in how he thinks about what actually moves healthcare forward. So, Ed, thank you very much for being here. I'm really looking forward to chatting with you.
Yeah, no, thank you for having me. I've been looking forward to this all week.
Amazing. Let's just dive right in. When you walk into a hospital or care environment, what are the friction points you notice immediately, the ones that may have normalized or stopped seeing?
Yeah, I think we're so used to it that it's kind of scary.
Yeah.
And it's not until we go to another industry that we realize, oh, things can be different. Things can be improved. So I think a common friction point is just access, right? It's
Mm.
just how long do you have to wait? Like if I want to go get a coat or a new car, there's something a
Yeah.
little bit more sophisticated, a new car. I can go to a wide variety of places today, right after we're done, and within an hour have a car. But
Yeah.
in
Fair.
healthcare, like even primary care, it
Yeah.
takes forever. So there's a major friction point. And then once you get there, you're running into a bunch more friction points. Could be parking,
Right.
then finding your way, then waiting, even though you made an agreement that we're going to meet at 1 p.m., you're going to be waiting. And then there's still 5-year-old magazines in there. I took a picture. I had a knee procedure done recently,
Hmm.
and I was laughing because I was taking a picture of the magazines just to make a point. They were literally like 5 years old. Had that been my physician who was doing this very complicated stem cell procedure on me, had that been his office, I might have left
Right.
because that would be indicative of other things. But he was just borrowing this someone else's. It was someone else's office.
Got it.
So anyways, there's like three or four major
Yeah.
friction points, and we didn't even get to see the physician yet.
Right.
Yeah,
No, and I think I mean, that was kind of what I had noticed when we started Care Wear was it all started with a sock and seeing people wearing socks. I was like, I don't know anything about healthcare. I know nothing about fashion, but I know you shouldn't have to wear a sock. And to your point, I totally agree. I think it is how do you kind of bring that healthcare and humane experience back into healthcare?
yeah,
Um,
exactly.
so, healthcare leaders in general talk a lot about innovation, human-centered care, and better experiences. You yourself led innovation for one of the world's probably most innovative healthcare systems ever. What actually gets prioritized, though, can look very different than what people talk about. In your experience, and you kind of alluded to this a little, but what really drives those decisions day to day?
Well, what's really interesting, two anecdotes. One
Yeah,
a couple years ago at that organization, and then one that happened this week.
yeah,
So a few years ago, yeah, I was responsible for digital strategy, and of course, I brought all my peers together in the C-suite, right? We were lockstep, so
yeah,
much so that they presented parts of the plan for approval. So when it got approved at the C-suite, I knew, of course, you have to engage everyone, and no
totally.
better way to engage them than have them own part of it. So they
Yeah,
all owned this plan that was obviously approved because they owned it and they helped
right.
author it. So 6 months later, so of course you have the plan and everything you do should have alignment to that plan. 6 months later, we had a visiting professor come through and from Harvard, and he's, super well known for strategy and alignment and all that kind of thing. So he was like, "Oh, everyone, write down on a piece of paper the number one priority for the organization and hand it to me." And I was like smiling because I was like, I know what it's going to be.
Yeah,
It's going to be patient experience because we just did this digital strategy and we came up with the top 10 things and number one. So he took them and then he read them out loud. And out of the 8 members of the C-suite, I don't know that any two matched, you know?
yeah,
So even though organizationally we all agreed,
right.
everyone still kind of does their own thing, you
Yeah,
know? And the other point of reference that happened this week, I help out with the Health Management Academy, and they
Hmm.
had surveyed all members of the C-suite, and then they made this very easy to read color-coded chart of the top 5 priorities. And so out of the 8 members of the C-suite, you could look across and you would think that maybe all of them would be same color for number one,
Right.
number two, number three, number four. They were all different. And
Jeez.
and so now, to be fair, they were, surveying 100 different organizations. So maybe within an organization, it would have been the same color all the way
Right.
across. But anyways, the point is that for some, number one was AI,
Yep.
but for others, that was number five.
Right.
So it's really important to have this strategic alignment if
Yeah.
you're going to achieve innovation, because it takes resources and everyone has to be aligned so that those resources are correctly applied. Or what also can happen is we agree that AI, let's just say our number one priority is reduce physician burnout, and we're going to
Yeah.
use AI to make that happen. Very common thing that's happened over the last couple of years, ambient
Right.
AI. And so we can all think that's important, but how it gets actualized or
Yeah.
funded can be a whole nother thing, because everyone's got their little pet projects and things they want to do. So strategic alignment is hugely important if you want to
Yeah.
get to innovation. And even when you think you have it, you may not really have it.
And I love that. So, today we take a three-pronged approach. We're always working with clinicians, always working with the end users, and then bringing in that fashion and design and technology to create a better product. But I agree, even with that, just like, and that's why I was laughing so hard when you were like, I knew that they were all going to say it, and then none of them did. Even with that, we still see a wild variety of things, and then it's still sadly doesn't happen overnight that we're able to bring these innovations to market. But
Yeah.
I think it at least, like you're saying, can help expedite that and
Yeah.
helps eliminate some of the big barriers for sure.
Yeah,
Um,
and what's exciting, I think there is a
yeah,
change, and I think the AI revolution has sort of prompted this change in that in the past. So, talk about innovation, like how come, obviously you're an exception, but how come we haven't innovated very much in healthcare?
right.
One is that, the whole strategic alignment type of thing, and everyone kind of doing their own thing. We have pockets of brilliance, is what I call it, but we're trying to move to an enterprise of excellence.
Yeah.
And and so one thing that made me feel better, so I do talk with a lot of health systems around the country every week, and there's an openness now for the first time to do what would have been considered risky in the past, and that's working with earlier stage
Hmm.
companies.
Yeah.
And in the past, right, you had to be at least $1 billion revenue. You had to be the IBM, of whatever, or the Microsoft of whatever. That's only who we're going to work with.
Yeah.
They would literally, and I know you know this, and you've helped bust this. You're helping lead this new revolution, but they would literally do all sorts of legal analysis and business analysis on the business, and they had to have 5 years of profitability because they
Yeah.
were worried that, well, what happens if they go out of business? And so you got stuck with these stodgy old companies.
Right.
And so no wonder you weren't innovating very much, because
Yeah.
you were stuck in these big bureaucracies. But now there's an interest, and the work that you're doing with some of your clients is busting the whole thing.
Yeah.
And now there's an interest. And in fact, it's more than an interest. They're forced to, or they're going to be forced to work with more agile, nimble, new thinking companies, because what's worked in the past clearly not working today.
Right.
And we truly want to have innovation to do the right thing for our patients and the right things for our organizations, communities. We have to start thinking outside the box and
Yeah.
working with non-traditional companies like yours.
One of our most important clients told me the first time I met them, they said, you'll probably get a deal from us in 6 or 7 years because we want to
Yeah,
make sure that you're still around. But they are an enormous health system. And so their point was, we want to make sure we don't put you out of business by signing a deal with us, which
right.
is something as a founder you never think of because you're just chasing, chasing, chasing.
Yeah.
You're not like, oh, wait, and now I have to execute. I think another component is cost, obviously, right? And AI is a huge component of that hopefully can help reduce by billions, if not trillions of dollars in healthcare over time. As AI becomes a bigger part of healthcare, and especially as you explore this in the AI empowered patient, where do you see it meaningfully improving care today? And where do you think the conversation is getting ahead of what's actually possible?
Yeah, so for sure access, right?
Yeah,
And I think we touched on it, where it can take months for primary care, depending on your geography,
Yeah.
and it'll take months for sure for a specialist.
Yeah.
We could go through all sorts of examples, but I think all of your audience already knows this and has experienced it, unfortunately. So if we can take away the chore
Yeah.
part of care, allow clinicians to focus on core,
Hmm.
then that immediately is going to have huge impact on access.
Right.
Because right now, most primary care is an administrative assistant,
Yep.
and they're bogged down with administrative aspects and things that they have to do. Now, if you bring in AI, agentic AI, or whatever,
Yep.
I call agents.
Yep.
If you bring in the agents can do, I think, 85% of primary care.
Totally.
And again, we could go down a lot of examples, but I think most people would agree that agents could do a lot. They
Yeah.
may fight me on the 85%, but when I was doing all this research for the book and then digital strategy over at the Cleveland Clinic, when I spoke to the docs and all that kind of stuff, they were like, "Oh, 85%, Ed, we could automate and all that kind of stuff." So
Right.
I think that's going to be one immediate impact area that we're going to see in the next. Well, it's happening now. When we first came out with the thesis of the book about a year ago, people were like laughing at us. But now we're starting to see people talk like this and
Right.
actually starting to do this. And so I think access is going to be an immediate area. I think another one is going to be the reduction of costs, right? There's a lot of manual things we do today.
Yep.
And I won't tell you for obvious reasons the organization, but one organization has been so effective at leveraging agents and able to reduce some of their headcount that they were asked to stop because of the
Hmm.
impact on the workforce.
Right.
And I understand it. And I think, the benevolent thing to do is retrain your workforce. There's space for everyone.
Right. Totally.
You just need to give them opportunity. So those are two, one on the access side, which will lead to improved experience, improved
Yeah.
quality, improved revenue. And the other example I was giving you will be to reduce costs so you can invest more wisely or bring down the cost of healthcare.
No, and I love that. I love that you said the benevolent thing to do is to train people. And I think I host all these, as we were talking about, I host all these founders dinners every month. And I will tell you, at least on the startup side, none of us are really looking to cut headcount, right? Like,
Right.
I think we're trying to figure out how do you make it how do you make your team more efficient and how do you empower them to do the more fun and challenging work and not the menial tasks that
Yeah.
AI can take care of for them.
Yeah, and if you really care about people, you don't want them to continue doing the same old
Right.
thing that they've been doing because that's not going to help them in the future.
Exactly.
But you can retrain them. So if you are able to reduce headcount, reduce costs, you take some of those savings and invest in your workforce because you're going to need very smart AI thinking capable people to do a lot of the other things that we want to do, or these other things that will open up that we don't even know about. So if you truly are benevolent, it's not, hey, we're not going to do this because we're afraid of reducing headcount. No, reduce the headcount, create opportunity for those individuals to further their career, some other aspect of the organization.
I love that. A friend of mine gave us this recommendation and we've started incorporating it where we have an all hands every week and we have someone present how has AI helped them in their job this week.
Yes.
And it's just putting that mindset in, right? Of like, this isn't going to take my job, it's going to help me do more.
Yeah, absolutely.
All right. So as we think about a lot of healthcare innovation kind of gets framed around scale, right? But obviously before something scales, it has to matter to someone in a very real and immediate way. What do you think people miss about that first layer of impact?
Yeah, the that's the conundrum is we have
Yeah.
all these pilots and
Yep.
they very rarely materialize into anything big. So you could have a very successful pilot, all this, very successful pilot,
Yep.
meet your objectives, whatever they were, quality, experience, cost, revenue, and it goes nowhere.
Yep.
And I think part of it, and this is where I get in a little bit of trouble sometimes, but I just say
Yep.
it like it is.
Yeah.
We need leaders who are willing to take risk.
Yep.
So what happens is and I've seen this in my own career. I'm a good manager or director. I've got these great ideas, and I'm younger, at least in my career, and so I take risk, and I'm successful, and I'm promoted.
Hmm.
But now I'm a little bit older in my career,
Yep.
and I maybe have kids. I may be thinking about the 401, and I become very conservative.
Yeah.
So I work with a pilot because I want to still feel like I'm that innovative kid,
Yeah.
and it's cool. But man, do I want to take the risk? What happens if we take it now from one floor to the entire med surge or to the entire hospital and it doesn't work, and
Yeah.
I won't become CIO or I won't become CNO or
Right.
let's just keep everyone's happy the way things are. And that's the other thing. It's not just risk, fear of failure.
Right.
It's fear of, you don't want to be that person that rocks the boat. Hey, everything's fine. And we get happy. We get what's the word? When you're satisfied, content. And I had someone literally say that to me. I was already CIO. And one of the other chiefs pulled me aside because I had all these great ideas, right? I
Yeah.
was like doing all the things that you're doing and helping organizations with, and all these great ideas. And he pulled me aside. He's like, "Hey, Ed, you know, um, I was like you,
Ha.
and I came here. They hired me because I had all these good ideas. I came from, someplace, and and I'm telling you, man, it's just cool here. You can just, do your thing, and they'll be really happy with it, and just lay low. And I've got a great career. I'm making pretty decent money. And literally,
Yeah.
someone had that conversation with me, and so that's what happens too. It's like,
Yeah.
well, why would I want to take on something new?
Right.
I mean, that's going to just cost me more time, more energy, and then again, the fear of failure is playing in there. So I think that's what happens, and that's why we don't go to scale. So I think you need to find that person that is as excited as you are
Yeah.
as the founder and understands and has the broader vision. Like, not only I'm going to do great, again, whether it's quality, experience, revenue, reduce cost, whatever it is,
Yep.
not only is it going to be great for the organization, but man, what if we did this across the city?
Right.
Or, and then it's okay to be selfish. And here's another thing I'll tell you. And I've gotten in trouble for this too. I talk about brand. You as a leader need your own brand. Your
Right.
brand cannot be Hospital XYZ
Yep.
because when times are rough, Hospital XYZ will let you go.
Yep.
So I was always like, my first, like, I'm here to serve my hospital. I'm gonna do the right thing, and that means I am gonna push and going to work for innovation, even if that means I'm fired.
Yep.
And the second thing is I'm also working my brand. And if I want to be CIO or known for innovation,
Yeah.
I've got to take these risks. And I'm going to. And
Yeah.
that's what changes the world. That's what changes organizations. That's what changes people's lives. But again, what happens is we have this fear of failure, fear of what others will think. We have the contentment pressure,
Yep.
I'm going to get fired, all those sort of things. But what we need is brave leaders
Yeah.
that can make things happen. So as a founder, look for the brave leaders that don't care if they're fired.
Right. I love that. And I mean, what we've seen firsthand at Care+Wear, and it's exactly what you're saying is you don't all like, and I tell nurses this all the time. I remember when I first started with the pick covers, the nurses were like, I'm just a pick line nurse. I can't bring about change. I can't do
Yeah.
anything. And I'm like, first of all, you're the one that's interacting with the patient on the day-to-day basis. Like any good leader is going to argue the opposite, that you're the one that knows better than anyone
Yeah.
else what the issues are and how to resolve them. And so it's empowering people to have a voice and
Yeah.
to kind of speak
Yeah.
up, like you're saying.
And in that case, that's how, people are like, I tell a story where I really didn't get into the health IT ranks until my late 20s, and I was a CIO of a major academic center five
Yep.
years later.
Yep.
How did that happen? Everything we're talking about right now.
Right.
I ran into some creative vendor. They had some great ideas. I thought, well, that makes a lot of sense. There was alignment, like we talked about
Yeah.
at the very beginning, and there was these big problems, like we were talking about at the beginning. And it's like I made it happen with that
Yeah.
vendor, and then I got noticed, and they're like,
Right.
"Hey, we want that guy working at our health system." And so I saw these very quick series of promotions to all of a sudden I'm CIO. What of a
Yeah.
major academic medical? I was away my skis, whatever that is, skis were away from me or whatever.
Yep.
But I learned, and they adopted me and took care of me and helped me grow into a good leader. And then the next organization wanted me, and they're like, "Man, if he did that there, and then the next one, and the next one." So not only for the listeners, not only will you be doing the right thing for your organization
Yeah.
in the meeting the strategic priorities, but you will also help yourself. And moreover than both of those is you're going to change. You can be a world changer, right? The things
Right.
that you do, the things that you're doing for patient experience, the things that, the other innovators are doing, you're going to change the world.
Yeah. No, I love that. So let's go on the other side, I guess, on the vendor side or trying to pitch to a hospital. When you think about the future of healthcare products, what separates the ones that truly endure from the ones that are just reacting to the moment?
I think is the number one thing is that you can demonstrate that you truly understand and there's this empathy.
Yeah.
And so there's different ways of doing it. I get and I listen to them because I just want to because part of it's my learning. These are founders or like brand new companies. Like someone
Yeah.
has a good idea, I
Yeah. Yeah.
listen to them, I talk to them, and what I always tell them is, yeah, that's great, because there's a lot of great ideas,
Yeah.
and what's your experience like? Do you know what it's like? And oftentimes, there's a story like my dad was in the hospital, my mom, or
Yeah.
I had something, and so I thought I'd create my own company. But what are you doing, and what are you doing with your engineers? What are you doing with your people to understand, the human-centered design that you're really good at,
Yeah.
and also that you truly know, not just from your dad's experience, your mom's experience, but you truly understand. And there's easy things you can do to get that. And so one, so again, I'm answering your question, but
Yeah.
probably in different ways than some of your other guests. But it's
It was
like
great.
getting ingrained.
Yeah.
So you can do that by volunteering.
Yeah.
Volunteer every week. I volunteered at hospitals throughout my career and I worked there.
Right.
So you can do it. And then I always tell people that give me excuses about kids. Now, depending on the age of your kids can volunteer too. And so
Yeah.
that I did that. When my kids were teenagers, they volunteered with me. And it
Love
was a
that.
beautiful. I mean, I checked a lot of boxes along,
Yeah.
doing two things at once. And they were changed. I mean, I won't
Yeah.
go into the stories, but they were changed. So volunteer, spend time in a hospital. That's why a lot of times with some of my clients, I have them tour hospitals with me.
Hmm.
Now, I know hospitals really well, but every
Yeah.
week, this week, I was in three hospitals.
Yeah.
Every week, I'm in hospitals. I'm bringing people with me because they got to see and feel and understand. And it's not just a one-time thing. You got to do it all the time.
Yep.
And so I think that that's one thing that really helped differentiate them from the pack. And then focus. The second thing is focus on experience. Don't, a lot of times they get focused on the technology. This is AI. I could care less. You don't need to say the word AI.
Right.
But if you know that the number one priority for my organization is, let's just say, patient experience,
Yeah.
then talk about how what you have is going to change the game with patient experience or clinician experience. What you all do with patient experience. Um, Show us, like, demonstrate that and talk that way. I can tell you a story where, well, I was actually at this particular company, a large systems integrator, a global company, and we won some major deals. And it's not because we were better technically than our competitors, but this is how we opened. We opened by talking about patient care and the experience and the expectation of the clinicians that
Yeah.
everything works and that works fast and all the time. And that's what we talked about. They talked about later, like towards the end, about we got great engineers. Everyone has great engineers.
Hmm.
Talk about how you're differentiated because of the experience. And how did you get that experience? Because you spend time continuously in the environment.
Yeah. I love that. And I totally agree with you on volunteering. I think there's no better way to kind of learn. And even if it's unrelated, like I sit on the NYU Patient Advisory Research Council. And look, Care+Wear is not doing any clinical trials anytime soon, but it's still fascinating to learn about.
Yeah.
And you still get to learn about so many different aspects. Today, I was actually in the hospital getting a CAT scan as part of being on the board. They asked us to be a part of a study, and so got to experience firsthand how terrible the gowns are, and was like, "Huh,
Yes.
I know
Yes.
a guy that can make a better one."
Perfect for you.
Yeah,
Yes.
no, exactly. So awesome. This has been great. I have now some quick fire questions for you.
Okay.
Um, and what is so you obviously get very busy, and I love that you had your kids volunteer with you. My parents did the same for us at my mom's hospital. What's one thing that helps you reset when life gets busy?
I love spending time with my wife,
Yeah.
and we just go on walks.
Ah, love that.
So even if it's neighborhood, I can give you other examples of,
Yeah.
like these great experiences, but I know that's not practical all the time. So just
Yeah.
going outside in our neighborhood, it's like a mile loop and
Yep.
holding hands and just chatting.
Love that.
Yeah.
Um, so besides your own book, because everyone here should get the AI empowered patient available today. But if is there a book, podcast, or resource that you find yourself recommending a lot?
Yes. So my go-to podcast, I was just listening on the way back from this conference I was in. It's called Art of Manliness,
Art of
but it's
Manliness. Okay.
yes, but it's not about, it's not what it sounds like.
Yeah.
So it's good for men and women.
Yep. I still run very slowly to how I built this. Um, speaking of running, what is your favorite race that you've done?
Yeah, two. I have to mention two. For
Yeah.
triathlon, it's Escape from Alcatraz.
Yeah.
So you
I remember
start
you
off
telling
at
me about
Alcatraz.
that. Yeah.
Yeah, that is like amazing just because of the views. And in terms of the hardest that I love, still think about doing one more time. I've done it 5 times. It's the World Championship for the long distance duathlon, which is run, bike, run, and it's in the Swiss Alps.
Oh, wow.
So it's in Zofingen, Switzerland. It's called Power Man.
Yeah.
And that is harder. I've done Ironman, stuff like that. Power Man is harder than Ironman, which includes a lot of swimming.
Right. I mean, that sounds like something I will never do, but more
Yeah.
power to you. Um, what's one, so obviously you've given us a lot of great advice today. What's one piece of advice that has stayed with you over the years?
So think as a servant, like how
Yeah.
can I serve you? So whether it's a customer, an employee, your spouse, your
Yeah.
kids, it's like, hey, what can I do for
I
you?
love that. I think in all my previous roles, I've always said customer service or customer experience person on the team is the one that is the best employee because they're interacting with your customer each and every day.
Yeah.
And I make everyone, myself included, do a customer service shift because it's the
Love
only
that.
way that you're going to truly understand what people are thinking and saying. And then outside of healthcare, what's something you genuinely love spending time on?
So I love sports.
Yep.
So going back, I'm part of Team USA triathlon, and I love competing. I
Yeah.
love the challenge, and it provides a lot of discipline and fulfillment.
Love that. Well, Ed, this has been really incredible. So grateful for you to take the time out of your busy schedule to speak with us. And thank you for everything you've done and you continue to do. I think it's people like you that are driving that innovation forward and not being afraid to fail. So we really
Well,
appreciate it.
thank you for having me. It's been a pleasure.